Hello all, and thank you very much for tuning in to COVID Conversations by way of Zoom for WNCU 90.7 FM. We're using this platform to talk about how COVID-19 is affecting us in our everyday life. I have as my guest today, Dr. Michelle Cotton-Laws. She is a co-lead for DHHS, Historically Marginalized Population COVID Work Group, and the Assistant Director for the Division of Mental Health and Substance Abuse Services. Hello and welcome.
Hi, Kimberly. Thank you. It's an honor to be with you today.
Thank you. It's my good pleasure. I know that you are super duper busy coming off of one meeting, probably coming into my meeting. I'm sure you have to later on as well. Very busy.
That is true, but I always take time for you. And I'm such a fan of WNCU, so it's always a pleasure to be a guest on any platform for you.
Very good. Okay, here we go. Let's get started. Dr. Laws, you've been working on the DHHS Secretary Mandy Cohen's COVID response team as one of the co-leads for the Historically Marginalized Populations Work Group. I want you to please tell us a little bit about the work that your team is doing and just why was it created?
Thank you, Kimberly. That's a great question. One, I'm very proud of the work that I'm doing along with two other co-leads and many other team leads for our Historically Marginalized Population Work Group, led in large part by Deputy Secretary Ben Money, who's our executive lead on it, and myself, along with Janet Sullivan, who is the Diversity and Inclusion Director for DHHS, and others including Deborah Farrington, who's Chief of Staff for Medicaid, Cornell Wright, who is the Executive Director for the Office of Minority Health, Jeremy Collins, who's on the governor's team and is over the Office of Public Engagement, and many others are doing some what I think is really critical and important work to zero in on the factors that are contributing to the disparate impact that COVID is having on what we identify as historically marginalized populations, which are in North Carolina, as we've identified them, African Americans, American Indian, Latinx or Hispanic, immigrant populations, and refugee populations. Yep. And so our work group is set up. It includes internal as well as external members, so people from universities, people from community-based organizations, advocates, and the like. And we focus on 5 core areas: engagement, communications, testing, social isolation, supports, and essential workers really is the overarching focus. And really to identify service gaps, identify policy gaps that we need to lift up to department leads, including the secretary, that we think it could prove impactful or meaningful in changing the trends that we're seeing in those communities.
So I want to talk about that just a little bit. What are the data trends telling you about its impact on African Americans and other historically marginalized communities and populations in the state?
Yeah, so I pulled the data for today, and it's up. It was last updated on, and anyone can get access to this data. And I encourage people to follow the trends just like we are. We've completed over 1.6 million tests across the state, and currently we have 1,170 people hospitalized. But if you disaggregate that data, what is really troubling to many of us that work on the Historically Marginalized Work Group, when you disaggregate that data and drill down and look at it by race and ethnicity, what you will find are disparities in cases and disparities in deaths. And we haven't been able to really hone in on the hospitalization data, but anecdotally, knowing what we know about who's most likely to enter this COVID pandemic sick already or facing multiple chronic health conditions that place them at high risk of not responding well to the COVID virus once contracted. We know that African Americans and other historically marginalized populations shoulder a disproportionate share of health conditions and diseases. And so when you disaggregate the data, just looking at the case data, for example, 42% of confirmed cases are that we have in our data system are represented among the Hispanic or our Hispanic and Latinx populations, 42%. And that's compared to 24% of confirmed cases for African Americans or Blacks. But when you look at the death data, when you look at those who are dying from COVID, African Americans, even though we make up 21% of North Carolina's population, we represent 32% of the deaths. And that's compared to even the Hispanic and Latinx community that has the higher percentage of confirmed cases. They have a much lower percentage of the deaths compared to African Americans. So African Americans, 32% of the deaths, although they make up 24% of the cases. Hispanic and Latinx populations, 11% of the deaths, although they make up 42% of the cases. And so we, when we drill down by race and ethnicity, we know that those that are being hardest hit by race and ethnicity are African Americans and Latinx. But that does not mean that the American Indian population, even though we're not seeing the same kinds of numbers impacting them. So, for example, they make up 2% of the deaths, although they make up about less than 1% of the case of the state's population. And so that indicates to us that there's a disparate impact on the deaths in terms of deaths also for the American Indian populations. And then when you think about their cases, they're right at 1%. And so we know that those populations that historically have been disparately impacted by health conditions and diseases are also showing up through this COVID pandemic. And then, of course, we can look at differences by geographic location. We can also look at differences by socioeconomic status. People who don't have resources, for example, to safely and healthily quarantine. You know, they live in multiple generation houses, right? Houses where they got cousins and grandmas and, you know, so it's not just a nuclear family with a mom, a dad, and children, or a mom and children, or a dad and children, right? They're oftentimes in these populations, you see multiple generations living in the same household, you see crowded conditions, and so that makes it very difficult to quarantine. And so there are other factors too. So socioeconomic status also is playing a huge role. The social drivers or social determinants of health, as we call them.
So I want to talk about now, like some of the risk factors that place African Americans at higher risk for COVID deaths, and Hispanic, Latinx, and African Americans at higher risk for COVID cases. That the numbers are staggering.
They are, Kimberly, they are. One, again, you know, the health disparities are historic, systemic or structural, and they're persistent. So racism has infected all of our social systems, our health systems and other institutions, educational institutions, you name it, right? It has infected our systems in America. And it's very difficult for us to untangle its effect from current conditions and realities. So one is that long-standing, persistent effects of racism and discrimination. And then the other is that people of color are disproportionately at risk for more severe illnesses from COVID due to pre-existing health disparities and conditions. Now, I don't want anyone to take that and think that we are somehow predispositioned genetically, that we have a genetic predisposition. When you look at multiple factors that contribute to health disparities, often you'll find that many of those factors are social drivers, right? So poverty, right? So who, even though by the raw numbers, whites there are more whites living in poverty. When you look at the numbers comparing their representation in the general population, you'll find that many Hispanic, Latinx, African American communities are crushed under the grips of poverty, long-standing generational type poverty. But you'll also find other socioeconomic factors, working in low-wage jobs, for example, which places them at higher risks when they are less likely to be able to work from home, for example. So you find them in service industries where they're coming in contact with the public. You find, African Americans, Hispanic, Latinx, and even American Indian populations disproportionately represented in what they call these essential jobs. So out interacting with the public, being, working in low-wage jobs where they may not have, sick leave, where they may not get paid to be out sick. And so, having to go to work, making a decision, do I stay at home, not get paid, recover, or do I go to work and then potentially, if I have contracted the virus, expose others? And so you've got people who are having direct contact with the public, which increases their risk of exposure. You've got people working even secondary employment, which also increases risk of exposure. And then again, not having a sick leave opportunities that afford them the chance to stay at home and to or to self-quarantine. And then again, you've got access to health insurance. Many of those people that we are seeing now impacted fall in that gap of uninsured. So they don't make enough to afford the least expensive plan under the Affordable Care Act, and they make a little too much to qualify for Medicaid under the current guidelines in terms of their percentage of the federal poverty level. And so you've got a group of people that are working, and they're working sick. Some people are working exposed. And then my background, my research, I have a PhD from VCU School of Medicine, and my research looked at the effects of stress on chronic health conditions, specifically hypertension in African American women. And so stress is a factor that I think we need to pay a lot more attention to, and its impact. Stress compromises our immune system, which makes it less likely that we're able to fight off illnesses and disease, viruses in this instance. And so the effects of stress, my grandmother used to say, and now I find myself saying it, if it ain't one thing, it's another. And so, there's what some researchers have identified as this weathering effect, right? This erosion, so to speak, of our organs, our overall health, as this ongoing, impact and effect of stress really beating us down, right? Weathering us. And yes. Some effects of it is, some people say that, it causes us to age faster, but the interest that I have is not so much, it causes our organs to age faster. And so looking at the effects of stress, some interesting data that was reported by the Economic Policy Institute, and actually it was reported using data from the U.S. Bureau of Labor Statistics, found that only 19.7% of Blacks reported that, and 16.2% of Hispanics reported that they have the ability to work from home. The rest are getting out every day during this pandemic. And we are at a place now where I think we are experiencing widespread community spread. And so that means you've got more and more people out interacting and engaging. And then we've got, the social protests, the mass gatherings, yes, and so forth, that's also heightening the risk for historically marginalized populations.
So our time is running pretty low, but I wanted to get in two of the other questions that I had for you. So if you would be brief with this, but I really do want to get them in. So what is it that community members need to do to protect themselves to prevent the spread of COVID in these populations?
Great question. So several things that we are providing guidance on and promoting at DHHS. And one is from the prevention side, right? So wear a face covering, covering your nose and your mouth, right? So wear a face covering, if you want to call it a mask or what have you. It doesn't have to be the medical grade, but make sure you are wearing a face covering when you are out, especially interacting in the public square, when you are out in public, when you are going to the grocery store. Wearing a face covering in public is extremely important for us as a preventive measure and is also a control measure. Waiting until you're at least 6 feet apart from another person, keeping a distance, a safe social distance. And then also, washing your hands. So those are the preventive measures and also the control measures. The other thing, make sure that if you have symptoms, and you can go to our website and to check your symptoms, actually. So you can go to the COVID website that we have, which is covid19.ncdhhs.gov. And we have a tool there that says check my symptoms, and you can check your symptoms. Get tested if you believe that you, or even if you're not sure and you're like, you know what, I've had this running nose, I've had this fever, maybe not even a fever, but you've had other symptoms. Get tested. We have implemented what we're calling our CHAMP initiative to increase testing, free testing in communities, and that's community testing in high priority and marginalized populations. Go on our website, the same link that I gave you. You can find a testing site. You can find a community testing site. Get tested if you think you are, and then follow the recommendations, which is to social isolate and quarantine. And then the other part linked to testing, if you tested positive, you will receive a call from a contact tracer. Respond to that call, ask them if they're with DHHS. The number should come up that they're part of the local health department or our community tracing teams. Make sure that you provide them with the information. But I say, really wear your face covering out in public. Get tested if you think you are positive, have contracted or been exposed to COVID. And those are two critical things that we can do in addition to the 3 W's: wash, wait, and wear.
We have come to the end. And I think that we probably could go another hour or two because you're so well versed in what it is that we need to do to be able to combat this virus. So thank you. Thank you, by the way, too, for the face mask demonstration. Wear your mask when you're out in public. Yeah. Thank you so much, Dr.
You're so welcome. May I put in another plug really quickly?
Of course you may. Of course you may.
We know that this is a very stressful time. We know that people may be experiencing mental health issues or conditions as a result of COVID and its impact. People losing their jobs, people potentially losing their homes and so forth. So if you need help, we ask that you contact Hope for NC Helpline, which is 1-855-587-3463. The Hope for NC Helpline, 1-855-587-3463. And look on our website for other resources, including the Alcohol and Drug Council of North Carolina, and also the National Suicide Prevention Lifeline, which is 1-800-273-8255. We need everyone healthy. We can make it through this. Following those, wait, wash, and wearing your mask, and make sure you're getting tested. We will make it to the other end, as one of our major influencers in the African American said, former Congresswoman Eva Clayton.
Thank you. Thank you.
Thank you.
So much. I just appreciate everything you do. You're such a great friend of WNCU.
Thank you so much. It's a pleasure. Love your work.
Yes, and thank you so much for tuning in to COVID Conversations. I'm Kimberly Pierce Cartwright. See you next time.